PRP is the most commonly done procedure, as you all know, and it is one of the most commonly sorted procedure for both men and women for the hair losses and for the hair restoration. Here comes the question: how much is the cost of it? So, because you're seeing a lot of people are doing PRP from anywhere between 1,000 rupees, 2,000 rupees to 20,000 rupees. So what you think is the cost actually, which is varying between 2,000 to 20,000 rupees. So it all depends on the technique what they are using, because sometimes PRP, if you do in a plain tubes, which is available in the labs, because people end up doing for the very low price, but the effectiveness of the total treatment actually will be very less, because the centrifugation and the separation of the platelets, so that will actually affect the entire outcome. So that's where comes few companies have devised their own patented technologies in PRPs. So based on them, the price actually varies. But at least most of the centers which are reputed will actually start from the basic PRP, start from 5,000 rupees, and advanced PRPs, where actually your platelet counts goes 10 to 20 times higher than the regular PRP. So there, I mean, it costs you around maybe 15 to 20,000 rupees. So you can roughly say 5,000 to 15,000 is the general cost of the PRP treatment, based on your indication and the place where you are getting the procedure. PRP actually adds volume, because what happens when you actually give PRP, the nutrients and the growth factors in PRP will actually bring the phase, change the phase of the hair from cataphase to anaphase, where most of the hair will actually, the falling will be less and the growth will be higher. So naturally, you will start seeing small baby hair growing within 2 to 3 months of first session of PRP. Maybe by third session, actually, you'll appreciate a lot of new hairs coming, and the old hair, which is actually falling regularly, will actually get arrested. So that definitely the volume increase will be appreciated in usually 5 to 6 months time after PRP session. So nowadays, the hair loss is a global phenomenon. We are actually seeing people from very younger ages, from age of 15, 14, losing a lot of hair. I think most of this is attributed to nutrition and vitamin D deficiencies and a lot of mineral micronutrient deficiencies. So we generally don't recommend PRP anything below 18 years. It is always safer to go PRP post 18 years. Before that, probably most of the hair loss can be corrected with the nutrition correction or whatever. If it is a seborrheic scalp, probably some shampoos might help them. So you need to treat the cause rather than directly jumping for the PRPs. Better age for PRP is 18 and plus. People ask for how many sessions actually require PRP. It is 6 sessions, 8 sessions. It all depends on indications you have. If at all, so typically it's a female pattern hair loss. I think probably you require 5 to 6 sessions, which is usually the interval of 2 to 3 months based on your pattern of hair loss. And if it is for the preservation, you already have a decent hair, but it's just diffusely thinning, then probably you require 3 hair PRP treatments per annum. And it has to be a continuous process. You can't say that PRP is a one-time procedure. PRP is a more of a maintenance procedure. So when you're asking your doctor, you should ask clearly that, and based on your available time and other things, PRP, you should ask maybe 2 or 3 times a year. And you should continue whatever the medication doctors prescribe to you to maintain the hair which is grown by PRP. So it is essential to get at least 3 or 4 sessions per annum if you are maintenance. If it is for a diffuse hair loss and temporary hair loss, and to stop the arrest the hair loss, probably you require 6 to 8 sessions with maybe 1 month or 1.5 month interval. When people are getting PRP sessions, they commonly ask, when can I see the result? So people start coming after 1 month and saying that my hair is still same. So you have to understand, hair has cycles. So when you're converting from one cycle to another cycle, and the root to stimulate the root to come out and again to see a visible result, it will take at least 4 to 6 months. So maybe after second or third session of your PRP, you will start seeing, if you can see the scalp with the trichoscope or microscope, then you'll able to identify the small new hairs which is coming out. So best results are visible after 4 to 5 months and maybe 6 months sometimes. If at all, if you're a smoker, the results are going to be delayed.